I know we talked about AS and AA, but it looks like there are also like AC and other things that could be term sickle cell disease, as well as just the straightforward SS patients.
Yes, sickle cell disease happens when we have a child that is born with the hemoglobin S. That's the abnormal sickle cell gene, the abnormal sickle cell in the red blood cells, plus another abnormal hemoglobin molecule. So when there are two abnormal hemoglobin molecules in the blood cell of a child, that child has SS disease. That's sickle cell anemia. But the child with sickle cell disease could have just one sickle cell gene, one hemoglobin S, plus another abnormal gene. For example, the Yoruba, the southwestern part of the country, we have a lot of abnormal hemoglobin C. Sorry, I use the Yoruba people because I'm a Yoruba person.
Me too.
So we have hemoglobin S and hemoglobin C. So when they come together, it is also sickle cell disease. We could also have sickle cell thalassemia, when we have sickle cell, one hemoglobin S gene and another abnormal gene that affects the development of the hemoglobin molecule, and that is another form of very severe sickle cell disease. So they're varying. We could have hemoglobin SD, for example, if there's an abnormal D hemoglobin. But the commonest genotypes that we have in Nigeria are SS anemia, which is when there are two genes for sickle cell disease, and SC disease. Those are the two commonest types that we have, although we also have the thalassemia traits in parts of the country as well.
Thank you for clearing that up.
Now, the person who is a carrier of the sickle cell gene has one normal hemoglobin molecule and one abnormal hemoglobin molecule, which is the S hemoglobin. So that person has a genotype which we refer to as AS. The person is not sick, but the person is a carrier of the sickle cell gene. And if that person, like I said earlier, marries somebody who is also a carrier of another abnormal gene, there's a possibility that the child could have a 25% chance with every pregnancy that the child could have sickle cell disease.
25%.
So some families can be lucky and they will have 0 children with sickle cell disease. Others might have 1 child with sickle cell disease. Others might have all of their children with sickle cell disease.
And we've seen a few of them like that.
We've seen that, yeah.
How do we prevent these terrible, terrible complications?
Well, the first way to prevent these complications is to identify the child that has sickle cell disease, which is still a major problem for us. I'll just spend 1 minute on what the government is doing about identifying children with sickle cell disease.
Good.
There are some centers in Nigeria that have the capacity to identify sickle cell disease in the newborn child, so that all children who are born in the country eventually will have their newborn screening for sickle cell disease. And that way we'll be able to identify the child with sickle cell disease and place the child on appropriate treatment to prevent these complications that we have spoken about. There are many centers. The closest one to us is at the Federal Medical Center in Kefi, which is a center where newborn screening can take place. So we need to be able to identify the child with sickle cell disease. Then we need to be able to place these children in areas where they can access care. Prevention of complications is very important. The children have to be looked after. They have to attend regular clinics. They have to be immunized against infections. They need to be protected from malaria, because malaria is still a significant problem in our environment, and it triggers off a lot of crises in children with sickle cell disease, including painful crises, needing blood transfusion, convulsions. So they need to be protected against malaria. We do this by giving them some medications and by environmental control using the insecticide-treated mosquito bed nets and looking after the environment. In addition to that, the children themselves have to know about the disease. Not only the caregivers have to know about their disease, but the children themselves should be educated as early as possible about sickle cell disease, which is a lifelong disease for them. So they have to know how to drink a lot of water, which helps in preventing their painful crisis. They have to know that they can play football for one half of the match and sit out the other half of the match, so that they can have a regular quality of life. In preventing some of the more severe complications of sickle cell disease, like stroke, there is a way in which it is possible to identify the child who is at risk of having a stroke. And this is by doing a test that is called a transcranial Doppler ultrasound. This test is done by looking at the blood vessels that are going to the brain, and if there are any abnormalities, it's a simple, very non-invasive ultrasound that just measures the blood vessels going into the brain. And once we identify the children who are at risk of having stroke, we can offer them treatment to try to prevent this from happening.
Good.
But the thrust is that we must identify the child who is at risk of having the stroke. And like I tell my mothers in the clinic, it is most important that we do this test, which is available in the country, which the federal government has placed the machine to do these tests in all of the geopolitical zones of the country. Okay. So we have some capacity to do these tests both in the public sector as well as in the private sector. And I tell my mothers, rather than buy that Christmas dress that you want, use this money to go and do this test. Because when you do this test, we can identify the child at risk of a stroke and offer treatment. It could be simple treatment, just like taking some drugs, or it could also be having to do with some more complicated things.
Well, okay, that's a good one. It's the 6 geopolitical zones. Is there a map that we can maybe put on the website where people can just go on to see where these Doppler ultrasounds scans are being done?
I will refer us to there's the sickle cell disease policy of Nigeria.
Okay.
It's been done by the federal government of Nigeria, and it shows exactly where these 6 machines have been placed.
Okay.
So it's available. If you just Google it, I mean, our children are Googling everything now.
Okay.
If they just Google where to do the transcranial Doppler ultrasounds in Nigeria, it'll come up with the map.
Okay.
But it's on the website of the
so they can find out where that is.
Yes.
And then you mentioned prevention of this. Once you identify those who are at high risk,
yes.
Prevention.
Yes.
What are the drugs available for that? Are they available in stores?
Yes, the drugs are easily available. What we use most commonly is the drug hydroxyurea. Hydroxyurea should be given by the specialists, by the doctors who are looking after children with sickle cell disease. We have a fair amount of experience now. It's been many years since we started using the drug. And the fear of the side effects by the public, what we have seen from using the drug is that these side effects are not as common. We don't see them commonly. So we have found the drug. We have used the drug at National Hospital for upwards of 10 years. And our children have grown up to go to university. They're doing well in school. And we haven't seen major side effects. Of course, there are always side effects from all drugs, even paracetamol. We might find some rashes on the children, but these are just minor, some nail discoloration. These are minor side effects, and the benefits we get from the drug outweigh these side effects. It's a very useful drug in sickle cell disease, but must not be bought by the parents for the child, but must be prescribed by the physician looking after the child that has sickle cell disease. Which
is very important. So you don't want to just go out into the market and just look for hydroxyurea. It has to be prescribed.
Yes.
Although that's a challenge, because you have to find the right kind of doctor who can prescribe the right kind for you. People in Abuja and maybe Lagos are very fortunate; they can have access to top-notch physicians. But it's a challenge in villages and other remote areas, I'm sure.
No, actually, I'd like to disabuse your mind of that.
Okay.
Because sickle cell disease is such a common public health problem that all physicians should be and are able to treat sickle cell disease.
Okay.
So all physicians should be able to identify the child with sickle cell disease, identify the child that they can look after in the primary and the secondary healthcare facilities, and identify the child that needs to be referred to the specialists. The bulk of the children are in the community and can be looked after by physicians in the community.
Okay, well, there you have it then. So that's good news, because we always think, oh, just very few people can do that. So that's great. Doc, so sorry we've run out of time. Folks listening in there, I mean, this we probably need to have you come back again and let's treat some of these things at greater detail. But thank you for making the time to do this today.
You're welcome. Thank you for having me once again.
Thank you, Mark.
Well done.
That's it, folks, for With Your Health in Your Hands. We will see you next week. Again, I'm Dr. David Ajibade. Cheers.